on every incident that arises to be able to retest them to see if there's an issue within their makeup and their personal imprint of that brain to determine what the care plan should be. So you've got that on the one side, right into cognitive disorders on the other side. This to me is a standard of care in the offering, which is just ready for clinicians to adopt.
All right, welcome back inside our proactive newsroom. And joining me now is Dave Johnson. He is the executive chair of Firefly Neuroscience. And Dave, it's good to see you. How are you?
Steve, I'm doing great. Thanks for having us on the program. We really appreciate it.
Yeah, excited to learn a little bit more about what you're doing. I know you've had some recent news out, and we'll talk about that in just a second, but maybe just give us a bit of background on Firefly.
Absolutely. So Firefly is a decade old in the making, Steve. We have put $60 million over a 10-year period-ish into developing a technology which is artificial intelligence in a technology frame that allows physicians to now have an objective assessment tool in evaluating patients who have cognitive disorders, mental health disorders, really brain health in general. And it's the first time a physician has actually had an objective assessment tool to help them in both their diagnosis and their care plan to improve outcomes moving forward. It's pretty darn exciting. It's actually the largest database approved by the FDA for normative age ranges for brain health. And we're very excited that we've come to a point we can now start to commercialize this and get it into clinicians' hands.
And is it a fact that you start with a baseline and then you sort of relate the data to what's going on with the normal brain to a brain that's suffering from potentially some sort of cognitive decline? How would it work?
Yeah, no, it's a great question. So you can really use it in two different ways. First of all, we do this all through EEGs, which are very normal in a neurology office, often used for epilepsy and brain and sleep disorders. And now you would have our software built into this EEG, which is very standard in a neurology clinic, would go up into the cloud and it would come down and provide an output report. And that output report would identify, based on what your age range is, what a normative value would be in society and where you fit on that normative range. And so you could very quickly identify, do you have an issue? Do you not have an issue? Is there a decline? That then becomes a baseline for you to have that done 2 months later, 4 months later, 6 months later, so you can start to see progression of any disease that is coming. And so you use it both as a baseline treatment, but also as a progressive treatment to create trends into your own personal health.
Dave, one thing we know is our population is aging rapidly. There's been lots of talk about that all over North America, really all over the world, if you like. And do you see this as something that's going to be, not necessarily, you might like to have it sort of the norm moving forward?
Oh, I think this has the ability to change the standard of care, Steve, in a number of different indications. On the one end, for traumatic brain injury, you know, hockey players, football players, people who have concussions, to create a baseline for these young men and in some cases women, and then on every incident that arises to be able to retest them to see if there's an issue within their makeup and their personal imprint of that brain to determine what the care plan should be. So you've got that on the one side, right into cognitive disorders on the other side. This to me is a standard of care in the offering, which is just ready for clinicians to adopt.
Okay. I want to talk about some recent news that he had out, agreeing on a partnership with the Neurology Consultants of Dallas, or NCD, if you like. So tell me a little bit about this partnership. It sounds like it's really the start of what you're talking about.
Oh, it absolutely is. And Steve, I think if anything it does, it validates that the technology has been adopted by a leading clinic. So 28 neurologists in the Neurology Consultants of Dallas, world-class leaders in their field who've been able to see the technology, work with the technology, and determine it fits into their standard of care. And, I would think that this creates a center of excellence in not only in the clinical development, but most likely in utilizing the data for both parties to be able to do more research, develop biomarkers in other areas. And we're looking that this is the first of many of these centers of excellence that we can use both in a clinical and in a research setting going forward. So we're very excited. They're tremendous partners, and we look forward to this being a key milestone in the company's evolution.
Yeah. And just on that, heading into the fall now, is that the main order of business to sort of get some more of these type of deals going forward? What can people expect over the next, 6 months to a year?
Yeah, I think there's two things in the very short term that people should be looking for. So we consider ourselves in a soft launch commercially right now. NCD would be one example, but there are others who we are working with, utilizing and implementing the technology into their own systems, learning from them so that we can move into 2025 with a full commercial launch, starting in neurology. But this is very applicable in the primary care physician's office as well, Stephen. So there's a large marketplace out there. We'll focus on neurology first, but I think there's going to be a flow through effect into the primary care physicians as we move into 25, 26, and beyond.
Dave, exciting times ahead, and look forward to following your story while all it's unraveling as well. So really appreciate your time. Thanks so much.
Thank you, Steve. Look forward to saying hi again. Bye bye now.
All right, sounds good. There's Dave Johnson, Executive Chair of Firefly Neuroscience.